This is the case of a patient with a very severe heart failure, an ischemic cardiomyopathy, and implanted with an ICD in secondary prevention for an episode of very fast ventricular tachycardia. He has to be extracted because of a problem of endocarditis, and then he went home with a LifeVest. And we will see that 5 days after he went home, he received an electric shock. This corresponds to this episode labeled treatments. You can have access to different information. If you click on trends, you can see the results, the daily results in terms of heart rate, steps, so activity, and body position. When the patient went home, you can see a progressive increase in the heart rate corresponding to an episode of heart failure decompensation. In parallel with the increase in the heart rate, you can see a progressive decrease in the activity, which is expected during an episode of heart failure decompensation. Now, if we look at the tracing of the episode requiring an electrical shock, you can see initially a sinus rhythm with a PVC, and then an acceleration in a very fast and polymorphic ventricular tachycardia. The LifeVest analyzes the heart rhythm using 4 non-adhesive electrodes, and the electrocardiogram is registered via 2 non-standard leads, side to side and front back. The heart rate is evaluated with an algorithm from multiple sources on each channel using a fast Fourier transform, and the algorithm compares the analyzed heart rates from the 2 leads. If these rates differ significantly, less weight is applied to heart rate in arrhythmia discrimination. So the detection algorithm uses a score not only based upon heart rate evaluation, but also on the morphology of the signals, the potential use of the patient response button that will delay the delivery of the therapy, and the analysis of the signal quality. Each of these factors can contribute negatively or positively to the overall results. Once the threshold for a VT or VF is exceeded, we'll start 2 phases. One of initial detection that will last for approximately 5 seconds. You can see it will start around at 14, and then after 5 seconds you will see this signal that corresponds to the initial detection of the arrhythmia. Then we'll start a phase of confirmation of the arrhythmia for 10 seconds. So here we are at 19, and then 10 seconds of confirmation. We will see this signal, 29, corresponding to the end of the phase of confirmation. When the arrhythmia has been detected and confirmed, the LifeVest will run an alarm cascade, including a tactile, visual, audible alarms. You can see here that will correspond to this signal when start the alarms with a change in the color of the tracing from black to red. So once the program detection parameters have been fulfilled, a sequence of alarm is initiated, starting with vibration in the belt electronics, then followed in the VF zone after 5 seconds by a low volume 2-tone alarms, and then a high volume 2-tone alarms, and finishing with a voice warning to bystander that a shock may be delivered. The amplitude of the audible alarm is high and can reach more than 100 decibels, the idea being to wake up the patient and or the bystanders if they are sleeping. So once the treatment sequence has been initiated, there are different alerts dedicated for the patient and the bystander. The patient prompt is press the response button to delay treatment, electrical shock possible, and the bystander alert is do not touch patient. Since the shock energy of a LifeVest is much higher than the one of an implantable defibrillator and can be compared to the one of an external defibrillator, bystanders must not touch the patient wearing a LifeVest to avoid electrical injury. And this type of accident can be avoided by carefully educating the patient, but also significant friends or family members. Just before delivering the shock, the defibrillation electrodes release a blue gel to reduce electrical impedance. So, if we summarize, the initial detection phase will last from 5 to 10 seconds. Then there's going to be a tachycardia confirmation for an additional 10 seconds. And then we'll start the arrhythmia alarms for a minimum of 25 seconds. So, the time elapsing between the onset of the arrhythmia and the shock delivery during a ventricular fibrillation will last approximately 45 to 55 seconds, as long as the patient is not inhibited the delivery of the therapy by holding the response buttons.